Hello, welcome to the TPP FY23 Tier 2 Rigorous Impact Evaluation Cooperative Agreements Applicant Technical Assistance webinar. My name is Tara Rice, and I am a Public Health Advisor with the Office of Population Affairs, OPA. With me as chat monitor is my colleague, Amanda Leeson, and later on, I'll be joined by Dwayne Barlow from the OASH Grants and Acquisitions Management Office. Next slide, please. Some logistics for today. Please make sure to tune into your preferred language channel, English or Spanish, using the globe at the bottom of your screen. Please be sure to keep your phones muted. The slides and recording of today's event will be posted on grants.gov. If you have questions during any point of today's webinar, please type them into the chat or email us at tpp23 tier 2ri at HHS.gov, which Amanda has just put in the chat. We will gather all questions together that are put into the chat and address them via a question and answer document that will be posted on grants.gov. This Q&A document will be updated weekly. Please note that we will not be answering questions live today, but we will be collecting the questions and posting the answers forthcoming. Next slide. By the end of the presentation today, you should have a high-level understanding of what's in the Tier 2 Rigorous Impact Evaluation NOFO, have an idea of who to contact for your NOFO questions, and be able to identify various resources that will assist you in developing your application. Next slide. Some reminders that today we'll be doing a general review of the NOFO and the application process. We will not answer specific questions about individual grant applications. And please be sure to pull up the NOFO from grants.gov using the link that Amanda has provided in the chat. Next slide. So here's the agenda, what we'll be covering. First, background of the TPP program and the Office of Population Affairs. Then we'll go into the programmatic expectations for recipients who are funded by this NOFO. Then we'll go into some budget and application submission processes. That portion will be covered by Dwayne. And then I'll come back to talk about additional resources and close us out. Next slide. I just want to remind you again about the importance of the NOFO. It provides information and guidance that relates to applications. Be sure to read it entirely and carefully. The NOFO takes precedence over any other documents or information that we might cover today. Next slide. And so next we'll go into the background of the TPP program and the Office of Population Affairs. Next slide. The TPP program is administered by the Office of Population Affairs in the Office of the Assistant Secretary for Health, or OASH. TPP is a national evidence-based grant program that helps provide adolescents with the support, confidence, and resources to thrive, be healthy, and realize their full potential and rights. TPP funds diverse organizations working to prevent teen pregnancy, unintended teen pregnancy across the United States. TPP program was established in 2010, and it has two tiers. The tier 1 replicates programs that have been proven effective through rigorous evaluation to reduce unintended teen pregnancy, behavioral risk factors underlying teen pregnancy, or other associated risk factors. And tier 2 are research and demonstration awards that develop, replicate, refine, and test additional models and effective strategies for preventing teenage pregnancy. You can learn more about OPA and the TPP program at the link that's provided on the slide. Next slide. OPA is releasing 3 TPP NOFOs this year, and this slide shows a summary of the 3 NOFOs. The one at the top is our tier 1 NOFO, which is currently out and open for competition. The one in the middle in blue is TPP tier 2 rigorous evaluation, the one that we're here to talk about today. And the one on the bottom is the Adolescent Sexual Health Innovation Hubs. This is a forecasted opportunity that should be posting very soon. Next slide. And this is our TPP continuum that shows how the 3 NOFOs interact with each other. In red circled is our NOFO, the tier 2 rigorous impact. And the key point here is that early stage interventions that are developed, refined, and tested through the hubs will come into eventually rigorous impact evaluation. And the effective programs that are identified through this NOFO will be available for tier 1 recipients to go in the future, to replicate in the future. Next slide. This is just a really brief introduction to who is eligible to apply for this NOFO. Dwayne will cover this in much more detail in his portion of the presentation. You can find this on page 15 of the NOFO. Basically, organizations, public or private, and private organizations includes a variety of for-profit and nonprofit entities that are located in a state as defined in the NOFO are eligible for applying for this NOFO. Next slide. Next, we'll go into high-level purpose and goals of this NOFO. Next slide. The purpose of the TPP Tier 2 Rigorous Impact NOFO is to rigorously evaluate promising interventions in order to identify those interventions that are effective at reducing unintended teen pregnancy for future replication by adolescent health practitioners and youth-serving professionals, as well as to disseminate research findings and lessons learned from rigorous evaluations to inform future studies and build evidence within the TPP and adolescent health fields. Next slide. A variety of innovative or promising programs, models, components, curricula, products, approaches, and strategies may be implemented and evaluated under this funding. Interventions that are eligible for being evaluated under this funding may work directly with youth or with caregivers of youth or with youth-serving professionals. Next slide. And in the introduction and background sections of the NOFO, particularly on page 6, we have identified certain approaches and promising types of interventions that we are interested in funding, funding evaluations of using this funding. We are interested in promising interventions that address key adolescent health disparities and have the potential to make a significant contribution to preventing unintended teen pregnancy. There's certain types of interventions such as self-paced and self-delivered interventions that we're interested in, certain settings such as juvenile justice or foster care, child welfare settings, certain populations such as expectant and parenting youth, youth with disabilities, youth experiencing homelessness, male identifying youth, caregivers of youth, and certain interventions that impact not only individuals, but also communities and systems within which individuals are situated. Now, We're not limiting competition to just these types of interventions, but these are interventions that we're especially interested in. So please review that section so that you have a better idea of what some of the priorities are. If your application does not fall within these priorities, but it's still addressing the overall goals of the NOFO, you may still apply. Next slide. And outcomes of interest that we're interested in interventions that will favorably address one or more of the following: unintended teen pregnancy, including births and pregnancy, underlying behaviors associated with teen pregnancy, including sexually transmitted infections, sexual activity, contraception use, risk factors associated with teen pregnancy. This may include mental health, educational attainment, healthy relationships, intimate partner violence, or substance abuse, for example. So please bear this in mind when we start talking about things later on, like intervention logic models or evaluation designs, that these are some of the key outcomes of interest. Next slide. And I'm going to skip this slide and keep going. So next slide. Next, we're going to talk about the programmatic expectations for awardees that are funded under Tier 2 rigorous impact. Next slide. So you can find the programmatic expectations beginning on page 7 of the NOFO. They are implementing a promising intervention, conduct a rigorous impact evaluation of the promising intervention, participate in a planning and piloting period, complete OPA materials review, collaborate with partners and maintain organizational capacity, engage participants in ongoing project planning and implementation, monitor and improve the project, document and package the intervention for future replication, disseminate project findings. I'll go into each of these in a little more detail. Next slide, please. The first expectation is implementing a promising intervention. We expect recipients to implement and evaluate an intervention that has compelling, positive preliminary evidence from previous evaluations or prior research. This includes documented effects on intended or related outcomes. So we're looking for interventions that already have some project merit, readiness, and feasibility at the time of application. We expect the intervention to be implemented strictly within the context of a rigorous evaluation, and we expect funded recipients to avoid duplication of other federally funded evaluation projects. So what that means is that we don't want to evaluate interventions that already have rigorous evidence of effectiveness. We don't want to fund something that's already simultaneously being funded by another federal office. So in the background, we have section of the NOFO, we actually list out some different types of interventions that might not be suitable for this award. So just pay attention to that and make sure that you're not proposing to evaluate something that's already been evaluated before, particularly if it's already been found to be effective. Next slide. The second of the expectations is to conduct a rigorous impact evaluation. We expect recipients to conduct the most robust possible impact evaluation that is feasible for the intervention and the setting that it's being implemented within and with the intended population. Generally speaking, we're expecting rigorous evaluations to be either a randomized controlled trial, or a CT for short, or some type of quasi-experimental design, QED, that has a comparison group. We expect all funded recipients to propose research questions that address behavioral outcomes specifically related to the prevention of unplanned teen pregnancy or associated and underlying risk factors. We expect that at least one research question will include and address a sexual risk behavior. Other associated risk factors or outcomes related to them may be collected, but should clearly be associated with unintended teen pregnancy. We also expect all funded recipients to participate in ongoing evaluation technical assistance. Next slide. And so to continue with the second expectation, conducting rigorous impact evaluation, we expect that the study quality should generally align with the HHS Teen Pregnancy Prevention Evidence Review Study Protocol version 6.0 where feasible. And Amanda will put that link in the chat. One exception that we are making this time around is that underpowered samples may be acceptable if your design and analysis plan still provide evidence of effectiveness. And so we talk a little bit about in the NOFO about some things that you can do with an underpowered design, such as Bayesian statistical methods to address that. So bear that in mind if you think that you're going to have a very small sample size. The HHS Teen Pregnancy Prevention Evaluation Review, the TPER, is a systematic process for reviewing evaluation studies against a rigorous standard to identify programs with evidence of effectiveness in reducing unintended teen pregnancy, STIs, or other associated sexual risk behaviors. TPER defines the criteria for a quality of study and the strength of evidence for a particular intervention. And the TPER standards were most recently updated in the fall of 2022. That's version 6.0. Next slide. Our third expectation for funded recipients is that funded recipients participate in a planning and piloting period during the first 6 to 12 months of the award. During the planning and piloting period, we expect recipients to work closely with us to refine, improve, and finalize the evaluation design and methods. We expect recipients to also, during the planning period, obtain any necessary reviews, such as institutional review board approvals. We also expect recipients to pilot test the intervention and the evaluation instruments. The duration of the planning period is contingent upon each recipient's demonstrated readiness, but should not exceed 12 months. By the end of year one, we expect that all recipients will be ready to begin the evaluation. And you can find out more about the planning period on page 10 of the NOFO. Next slide. The fourth expectation is to complete the OPA materials review process. So recipients are expected to ensure that all project materials are age appropriate, complete, trauma informed, culturally and linguistically appropriate, inclusive of all youth, and medically accurate. We expect recipients to submit all project materials to OPA for a medical accuracy review during the planning and piloting period. And we expect that recipients would finalize all intervention materials prior to the start of the rigorous evaluation. Next slide. The fifth expectation is collaboration with partners. That's on page 11. We expect recipients to use partnerships to fulfill capacity needs and to successfully complete the project. Recipients and key partners collectively should have all the experience necessary to successfully complete the goals and objectives for the project. And recipients are responsible for ensuring that all partners, including subawardees, meet the project expectations successfully and fulfill their roles on the project. Next slide. The sixth expectation is that recipients will engage participants in ongoing planning and implementation. This includes that we expect recipients to engage the intended population in planning and implementing the project. Members of the intended population should provide ongoing input into all aspects of the project to ensure that the project addresses their needs, is filling existing gaps, does not duplicate programs or services that are already available within the community, and that the intervention is generally a good fit for the population setting and or communities receiving it. So you can find out more information about this particular expectation on page 10. We provide some examples of how recipients might be consulted on the overall study and the intervention. This might be, for example, in the development of study materials, in the development of messages about project findings, and the development of the final program package, which we'll talk about in a minute. These are just a few examples that you can consider. Next slide. The seventh expectation is to monitor and improve the project. We expect that recipients will monitor the overall project and make ongoing improvements to the evaluation and the intervention implementation. We expect that recipients will conduct an implementation evaluation to assess whether intervention delivery is occurring as intended. And we expect recipients to collect uniform performance measures and report them to OPA twice each year. You can find out more about these expectations on pages 10 through 11 of the NOFO. Next slide. The eighth expectation is documenting and packaging the intervention for future replication. By the end of the award, recipients should document the intervention with sufficient detail so that other organizations may replicate the intervention to scale. And we expect recipients to be prepared to provide us with a complete electronic package of the final implementation ready intervention by the end of the project. You can find out more about this on page 13 of the NOFO. Next slide. Dissemination of project findings. You can find this on page 13 through 14. We expect recipients to develop and implement a plan for widely disseminating project findings. This includes implementation evaluation findings, impact evaluation findings and results, and other lessons learned, successes, and challenges. We expect all recipients to submit a final evaluation report to us by the end of the award. We also expect publication of at least one article in a peer-reviewed journal and presentations at professional conferences, as well as that recipients will disseminate findings to multiple audiences, including their key partners, the public, etc. Next slide, please. And so that covers all of the expectations for recipients. Next, I'm going to go into the application content section of this NOFO. Application content, there's three main pieces of this: the project narrative, the budget narrative, and the appendices. Next slide. Information on the project narrative may be found beginning on page 20 of the NOFO. Project narrative is the most important part of your application. It is used as a primary basis to determine whether your project meets minimum requirements for an award under this NOFO. Within the project narrative, you should clearly and concisely describe your project, including the significance of the intervention, the impact evaluation design, the implementation evaluation and project improvement, organizational capacity, partnerships and staffing, and project management and work plan. I'll go into a little more detail about what's in each of these in subsequent slides. Next slide, please. So on page 20 through 21 of the NOFO, the significance of the intervention section is discussed. A few highlights of some of what is covered in that section. This is where you're going to describe your intervention and clearly and succinctly. You identify it by name. You tell us how your intervention is unique, why it's innovative, what gaps it fills in the evidence base. You tell us why your intervention is likely to prevent unintended teen pregnancy or underlying or associated risk factors. Make sure that you summarize any previous testing and research and evaluation that supports this. Provide data to show the intervention is a good fit for the participants. And really, this is the place where you'll want to think about the who, what, when, where, and how of your intervention. Who gets it? Who administers it? What's in it? All sorts of things, basic details that support what you're talking about why it's innovative, why it's unique, and why it's likely to work. Next slide. Now, the impact evaluation design section of the NOFO is on pages 21 through 25. This is where we talk about what the pieces of the program of the project narrative that relate to the impact evaluation design are. And as you can see, there are several different pieces to this. And I won't go into detail about each one of these. I'm going to encourage you to please read pages 21 through 25 of the NOFO. The key things that you'll need to do in your impact evaluation design are to state your research questions, identify the type of evaluation study that you're proposing and justify the rigor, describe how your study groups will be formed. Remember that your rigorous evaluation has to have an intervention group and some sort of comparison group. So you'll need to describe how those are going to be formed. Comparison group experiences and the context just means that you're going to have to describe how you're going to separate these two groups, how you're going to ensure that the two groups are as similar as possible when you separate them. But then once you separate them, that you're providing contrast in the types of programming that each group is receiving. And the NOFO goes into a lot more detail about that. You'll need to describe your data collection plan and the outcomes that you're going to be tracking. You'll need to describe your human subjects protection and data privacy and security, which includes your institutional review board, or IRB for short. You'll need to discuss your approach for determining statistical power and a minimal detectable effect size for your study. You'll also need to describe your sample size and your recruitment and retention plans. You'll need to describe readiness and feasibility of your project. You'll need to describe biases, limitations, threats to validity, and potential how you'll ensure independence of the evaluation. And if you're proposing any supplemental analyses, you'll need to briefly describe those as well. So this is a lot. There's a template, optional template in the supplemental section of the NOFO, which I'll get to at the end, that you can use to organize this information if you would like to. It's optional. Next slide. The next section of your project narrative should cover your implementation, evaluation, and project improvement. It's pages 25 through 26 of the NOFO. In this section, you'll be describing how you will monitor the implementation of the intervention, such as monitoring dosage or how much of the intervention people get, fidelity, which is how well the implementation adheres to its core components or essential ingredients, and quality, which is a measure of how well overall the intervention is being implemented. You'll also need to tell us how you will collect and assess participant engagement and use that data in project improvement. You'll need to indicate how you will monitor the context within which the study takes place and track what services the comparison group receives, services or programming if any. And then finally, you'll want to summarize your plans to monitor the quality of the evaluation as it is occurring. So we give a lot of examples in the NOFO of things that should be collected and tracked during the evaluation as examples that you can address when you're writing your narrative. Next slide. The next section is organizational capacity, partnerships, and staffing. And so this is where you're going to describe your organization's capacity to successfully manage and implement the proposed project, identifying all key personnel by name and role, and be sure to describe the specific training, skills, and experience that they have relevant to their role in the project. Be sure to identify your principal investigator or project director, or your PIPD for short, as well as your lead evaluator. You'll want to make sure that you're naming the different organizations that you plan to work with on the project. You should provide signed memoranda of agreement, MOAs, or letters of commitment in the appendices if they're available before the application. If they're not available before you submit your application, then you should just provide a timeline for when you will get them. And you should be complete about describing what your staff will do on the project. Next slide, please. And then project management and work plan. This section is found on pages 27 through 28. In your narrative, you should describe project management in relation to the work plan. Specifically, who would have day-to-day responsibility for key tasks such as monitoring the evaluation, leadership of the overall project, monitoring the quality of the implementation of the intervention implementation, preparation of reports, communications with partners. And you should describe the approach that you'll use to monitor and track progress on various tasks and activities. And be sure that your narrative indicates the time that key staff have available for the project relative to their other commitments. Next slide, please. The budget narrative and forms, that can be found on pages 28 through 34. I'm not going to go into a lot of detail about this because Dwayne will cover this in his part of the presentation, but just some tips to bear in mind is that your budget should provide adequate funds to carry out the proposed work, and it should be reasonable and relate directly to the project goals and objectives. Next slide. And so finally, in terms of the appendices, your appendices should include a SMARTY work plan, logic model, a memoranda of agreement, MOA, or letters of commitment, LOCs, organizational chart for your project, curriculum vitae, resumes, or bio sketches for all key staff. It should also include a list of any references that you've cited, a bibliography that can go in your appendices as well. And I just want to emphasize for those of you who've applied in the past that we're talking about SMARTY work plans this time around. So specific, measurable, achievable, realistic, time framed, but also including I for inclusive and E for equity. So we have some resources in the back of the NOFO that address doing a SMARTY work plan. We also have some resources on our applicant webpage. So when I get to the end and I talk about resources, I'll tell you where you can find each of those, okay? Next slide, please. So that's a lot. And at this point, we're going to talk about budget and application submission and review procedures for the Tier 2 rigorous evaluation cooperative agreements. I'm going to hand the presentation over to Dwayne Barlow from the Office of Grants and Acquisition Management. Dwayne.
Thank you very much and good afternoon, everyone. My name is Dwayne Barlow, and again, I am from the grants team in the Grants and Acquisitions Office. And at this point, we're going to talk about application content and requirements. Next slide, please. Okay, so submission dates and times. Again, your application is due by 6 p.m. Eastern Time on May 17th, 2023. Keep in mind that your submission time will be determined by the date and timestamp provided by grants.gov when you complete your submission. So it's strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Grants.gov may take up to 48 hours to notify you of a successful submission. And keep in mind that if you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide, please. So in terms of applicant eligibility for this NOFO, we talked about it earlier in our presentation, but I'll just state it again here. So it's any public or private profit or not-for-profit entity located in a state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of the Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands is eligible to apply for an award under this announcement. Also, faith-based organization and American Indian, Alaskan Native, Native American organizations that are public or private entities are eligible to apply. Public or private community-based organizations are eligible to apply as well. Next slide, please. So here are some of the examples that we list out: state governments, county governments, city or township governments, special district governments, independent school districts, public and state controlled institutions of higher education, Native American tribal governments that are federally recognized, public housing authorities and Indian housing authorities, Native American tribal organizations other than federally recognized tribal governments, nonprofits having a 501c3 status with the IRS other than institutions of higher education, nonprofits without 501c3 status with the IRS other than institutions of higher education, private institutions of higher education, for-profit organizations other than small businesses and small businesses. Next slide, please. Cost sharing or matching. So you are not required to provide cost sharing or matching in your proposed budget, but if you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, that's the federal and non-federal share, to support the project proposed. Applications including voluntary cost sharing or matching that result in an award will include cost sharing or matching commitments on the notice of award at the level proposed in the application. Any change in that commitment will require prior approval of the grants management officer. Next slide, please. The notice of funding opportunity, or the NOFO announcement. So the NOFO notice of funding opportunity provides information and guidance related to applications. Please read that entire funding announcement. Please follow the NOFO carefully and keep in mind, as we stated before, that the information provided in the NOFO takes precedence over any conflicting information in any other documents, including this presentation. Next slide, please. So these will be cooperative agreements, and as such, we're going to have federal agencies' substantial involvement. So awards made under this NOFO will be cooperative agreements. A cooperative agreement is a form of assistance that allows for substantial involvement by the program office. Substantial involvement is in addition to the usual monitoring and technical assistance provided under a grant. In other words, assistance from the assigned project officer, monthly conference call, occasional site visits, ongoing review of plans and progress, participation in relevant meetings, and provision of training and technical assistance. Next slide, please. So substantial programmatic involvement for cooperative agreements under this NOFO may include prior approval for change of time that a key personnel are dedicated to the project and for replacement of key personnel. Key personnel includes any position that is responsible for the day-to-day management and oversight of the project, consulting with the recipient throughout the preparation and dissemination of materials related to the award, reviewing of recipient progress during the planning period and approval at significant milestones to move forward with full implementation, review and approval of so implementation plans and propose of that adaptations to the plans, and consulting with OPA on any adaptations to plans. Next slide, please. So also in terms of substantial involvement, we're going to be assisting the recipient in the review and revision of priorities for activities conducted under the cooperative agreement. We're going to be serving as a programmatic resource during the implementation of the project by participating in the design of activities and contributing with subject matter expertise. The identification of other organizations with whom the recipient may be asked to develop cooperative and collaborative relationships and partnerships to enhance the effectiveness of the project, and then reviewing and approving all program materials prior to use in the project to ensure the materials are appropriate. Next slide, please. The address to request application package. So you can obtain an application package electronically by accessing grants.gov at the blue URL that you see on the screen. You can find it by searching the assistance listing, formerly known as the CFDA, and that number is found on page 1 in the NOFO. The assistance listing, or the CFDA number, is 93.297. Please be sure to subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or supporting documents. Next slide, please. Application submission. So OASH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. So grants.gov is a website portal. All funding opportunities and grant application packages are made available on www.grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants and Acquisitions Management Division according to the deadline specified in the date section of the NOFO. You can contact grants.gov with any questions or concerns regarding the electronic application process, or you can give them a call at 1-800-518-4726. Next slide, please. So applications must be submitted as 3 files. File 1 has to include the entire project narrative. File 2 includes the entire budget narrative, including supporting documentation described in the budget narrative content section. File 3 should contain all documents in the appendices uploaded in the attachment sections of your grants.gov application. Required standard forms do not apply toward page count limitations in the submission requirements as stated in the disqualification criteria. Next slide, please. So any files uploaded or attached to the grants.gov application must be of the following file formats. So you can use Microsoft Word, PowerPoint, Adobe PDF, or image formats like the JPEG, GIF, TIFF, or BMP only. Microsoft Excel files will not be accepted. HHS OASH strongly recommends that electronic applications be uploaded as Adobe PDF. If you convert to PDF prior to submission, you may prevent any unintentional formatting that might occur with submission of an editable document. Please check the page count of your PDF and or print the file to ensure that the document does not exceed the page limit. Next slide, please. Please be complete and do not leave blanks on the forms unless the information is clearly not applicable. Keep in mind that the individuals submitting the application forms must have the legal authority to act on behalf of the organization. Next slide, please. To ensure successful submission of your application, carefully follow the step-by-step instructions provided at the URL that you see in blue here on the screen. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. So the application elements. In terms of forms, you need to have the application for federal assistance, or the SF-424, the non-construction programs form, or SF-42A, the disclosure of lobbying activities, or the SFLLL, and the project abstract summary. So as far as files for the project narrative, make sure you submit all project narrative content as a single acceptable file. For a budget narrative, submit all budget narrative content as a single acceptable file. So far as the appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide, please. With regard to the abstract summary, you must complete the abstract summary form provided in the application package. The abstract will be used to provide reviewers with an overview of the application and will form the basis for the application summary and the grants management and program summary documents. If your project is funded, HHS will publish the abstract from your form on tags.hhs.gov and usaspending.gov. The abstract may also appear on the program office website or other government website, so do not include sensitive or proprietary information in your abstract. Next slide, please. Okay. With regard to the application format, please be sure to follow project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For appendices and budget narrative, you should use the same formatting specified for the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. The UEI number and the System for Award Management, or SAM. To register your organization, you will need a unique identity identifier, or UEI. On April 4, 2020, the federal government completed its transition to the 12-digit UEI number as the required UEI for registration in SAM.gov. You may begin the registration process, including receiving your UEI, at the blue URL that you see here. And an entity registration checklist is also available at the second UEI that you see here, this bullet. You may register in SAM as either an entity applying for federal assistance awards only, for example, grants and cooperative agreements, or all awards, including procurement awards. Next slide, please. If you are registering a new entity in SAM.gov, you need to create a login.gov account if you don't already have one. The minimum time frame to complete an initial SAM registration online is 30 minutes. The time frame for an applicant's registration to become active is up to 10 days and may take longer depending upon volume, or if the SAM system flags the information you provide for manual validation. The average time frame for updates in SAM.gov to appear in grants.gov is up to 72 hours. If you plan to apply for this funding opportunity or think you might apply, you should ensure your organization's registration is active in SAM well before the application deadline and will be active through the competitive period. Next slide, please. The SAM registration must be renewed each year. If you're renewing your registration, your old SAM.gov username and password may not work anymore, so you'll need to create a login.gov account if you don't already have one. Next slide, please. We strongly recommend that applicants check for an active registration in SAM well before the application deadline. If you're successful and you receive an award, you must maintain an active SAM registration with the current information at all times during the active award. If you have not complied with the SAM registration requirements, HHS may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, all first-tier subaward recipients must have a UEI number at the time that you, the recipient, make a subaward. Next slide, please. Funding restrictions. So if you're successful and you receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75 currently in effect or implemented during the period of award, other department regulations and policies in effect at the time of the award, and any applicable statutory provisions. So with regard to costs, they must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulations and current policies. So with regard to indirect costs, they may be included per 45 CFR 75-414. Applicants should indicate which method or rate is used for this application. Keep in mind that pre-award costs are not allowed, and the salary limitation is $212,100, and that's effective January 2023. Next slide, please. Budget and narrative forms. So keep in mind that they must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO. Suggested table formats are also in the NOFO. And the plan for oversight of federal awards, keep that in mind. Forms, budget narrative, and detailed justifications do not count towards page limit. Next slide, please. Budget narrative and forms, tips for development. You must develop an itemized budget using Section B, Box 6 of the SF-424A for the first year proposed of the proposed project. For awards with an anticipated period of performance of 1 year or less, this will be the budget request for the entire project. Provide a budget justification, which includes explanatory text and a line item detail for the entire first year of the proposed project. The budget narrative should show and describe how the categorical costs, for example, salary, equipment, supplies, and consulting costs are derived. Discuss the necessity, reasonableness, and allocation of the proposed costs. Next slide, please. For subsequent budget years in an anticipated multi-year project, provide a summary narrative and line item budget for each year beyond the first. For categories or items that differ significantly from the first budget year, provide a detailed justification explaining those changes. Do not include costs beyond the first budget period in Box 6 of the SF-424A or Box 18 of the SF-424. The amounts entered in these sections should only reflect the first budget period. Next slide, please. More tips for budget narrative and forms. Indirect cost methods are described, again, in 45 CFR 75-414. This category has one of two methods that you may select. You may only select one, and you must clearly identify that selection in your submitted budget. If your organization currently has an indirect cost rate approved by the Department of Health and Human Services or another cognizant federal agency, you should enclose a copy of the current approved rate agreement in your budget narrative file. For that applicant that has never received a negotiated indirect cost rate, you may elect to charge a de minimis rate of 10% of the modified total direct cost, which may be used indefinitely. If chosen, this methodology must be used consistently for all federal awards until such time as an applicant chooses to negotiate for a rate. Next slide, please. If your proposed budget requests a rate that is less than allowed, your authorized representative must submit a signed acknowledgement that the organization is accepting a lower rate than allowed. To obtain a negotiated indirect cost rate from the federal government, you may contact the U.S. Department of Health and Human Services Cost Allocation Services regional office that is applicable to your state. The CAS regional contact information is available at the URL that you see here on the screen. Next slide, please. Application disqualification criteria. So if your application does not meet the following requirements, it will be disqualified and receive no further consideration. So it must be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. If you successfully submit multiple applications for the same project, we'll only review the last application received by the deadline. HHS.gov have to deem your application as eligible. You must complete the required forms in the application package. That's the SF-424, the SF-424A, the SF-LLL, and the project abstract summary. And your application must be submitted in the English language and must be in terms of US dollars. Next slide, please. Furthermore, if your application does not meet the following requirements, it will be disqualified and receive no further consideration. So your project narrative must be double spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides and font size not less than 12 points. Your project narrative must not exceed 50 pages, and the total application, including project narrative, must not exceed 100 pages. Next slide, please. Your federal funds request, including indirect costs, should not exceed the maximum indicated in the award ceiling on the NOFO per budget period, which is $1 million. Your federal funds request, including indirect costs, must not be below the minimum indicated in the award floor, which is $500,000. Keep in mind that if you have included voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. Your application must meet any application responsive criteria under Section C3 Other Application Responsiveness Criteria. Next slide, please. And so for the purposes of this NOFO, there are no other application responsiveness criteria. Next slide, please. Okay. Applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application scoring under the evaluation criteria. So please be sure to follow submission instructions carefully. Next slide, please. So with regard to the application review criteria, there's going to be 6 different areas. It's the significance of the proposed intervention, evaluation design, research question and study design, evaluation design, methodology, the implementation of the intervention and project improvement, and then the project management and work plan, and lastly, the budget. Next slide, please. So with regard to application merit review, eligible applicants will be reviewed and assessed by a panel of independent reviewers with technical expertise in applicable fields according to the criteria listed in the NOFO. The merit review process is formal and it's confidential. Federal staff are able to answer questions and ensure that the process is consistent and fair, but do not participate in discussion and assessment of the application. Then applications are reviewed by GAM staff for administrative and business compliance, and then by the OPA program office for staff for programmatic compliance. Next slide, please. Funding decisions. The Deputy Assistant Secretary for Population Affairs will make final award selections to be recommended to the Grants Management Officer for risk analysis. In providing these recommendations, the Deputy Assistant Secretary for Population Affairs will take into consideration the following additional factors: equitable geographic distribution, non-duplication or overlap with existing interventions, diversity of any of the following interventions, populations of focus, settings, and delivery mechanisms or location. Technical components in the evaluation design or intervention resulting in an unacceptable risk of meeting proposed project objectives. Next slide, please. Okay, so upon completion of risk analysis and the concurrence of the grants management officer, HHS.gov will then issue notices of award. So keep in mind that no award decision is final until a notice of award is issued. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Keep in mind that we're not obligated to make any federal award as a result of this announcement. Only the grants management officer or the GMO can bind the federal government to the expenditure of funds. If you receive communications to negotiate an award or request additional or clarifying information, this does not mean that you will receive an award. It only means that your application is still under considerations. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Review of risks posed by the applicant. So HHS will evaluate each application in the fundable range for risks posed by the applicant before issuing an award in accordance with 45 CFR 75.205. So OASH will use a risk-based approach and may consider any items such as the following as stated in the NOFO. So we'll take a look at an applicant's financial stability, the quality of management systems, and the ability to meet management standards as prescribed in 45 CFR Part 75, the applicant's history of performance, reports and findings from audits performed, and the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. Plan for oversight of federal award funds, excuse me. If your internal controls are available online, you may provide the link as a part of your plan in the budget narrative. We've also included supplementary material, which contains questions applicants may find useful in considering their plan for oversight of federal funds. Next slide, please. Non-funded applications as a result of risk review. So if we determine your organization does not meet either or both of the minimum qualification standards as described in 45 CFR Part 75.205A2, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. Information reported to FAPIS is available for other organizations to review when considering you for an award. Next slide, please. Okay, so now we get to the notice of award. So the notice of award notifies the successful applicant of its selection, the award amount, project, and budget periods. It includes any conditions on the award, in other words, requirements that must be met as a condition of receiving grant funds, and it includes standard terms, the reporting requirements, and contact information for OASH, GAM, and the program office. Next slide, please. Keep in mind that GAM is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. And keep in mind that unsuccessful applicants will be notified by the program office via letter. Next slide, please. Okay, so here's a summary and tips. For your project narrative description, please be clear, complete, and concise in the project description. Follow and address exactly what is requested in the NOFO. Don't make the reviewer search for the required information. Generally, the easier the application is to review, the better the rating or score. Keep in mind that reviewers are not allowed to do external research, follow embedded links, etc. Clearly identify the section of the application and in the sections of the application and indicate which component is being addressed. The project narrative must include all required information within the page limit. Do not use appendices to expand the page limit. Next slide, please. We talked about this a bit earlier in reference to the project narrative description. Make the goals and objectives SMARTY, that is specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. Activities presented in the work plan should relate directly to the proposed goals and objectives of the project. The program work plan, evaluation plan, and budget should provide a complete picture of how the applicant will address the needs as well as address the purpose and expectations in the NOFA. Next slide, please. With regard to staffing, staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what the staff will do, the expertise required, and the percent time they will be assigned to the project. Next slide, please. With regard to the budget, your budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of the project. Do not request more funds than are available as listed in the NOFO. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, projected program income, for example, from fees and third-party payers and other contributing funds. Next slide, please. Overall, include full names for your authorized official, your principal investigator / project director, and all essential personnel. Keep in mind that electronic submission is required. Please don't wait until the last minute to begin SAN registration or update your registration. Don't wait until the last minute to begin electronic submission. Problems could arise. Next slide, please. Okay, with regard to inquiries for this particular NOFO, if you have any program questions, as we stated at the top of this presentation, you can reach out to Ms. Tara Rice. Her email information and telephone number is listed here on this slide. If you have any administration or application or financial questions, you can reach out to me, Dwayne Barlow. You can see my email and my telephone number listed here. If you have any electronic submission requirements, you can reach out to grants.gov applicant support. You can use that blue URL, which is grants.gov, or you can reach out to them via email. You see that support@grants.gov email hyperlink. And then, of course, you can always contact them at 1-800-518-4726. Please keep in mind that you shouldn't contact OASH program or the grants office staff for grants.gov issues because we don't manage that site. Next slide, please. So at this point, I'd like to turn the presentation back over to Tara, and she'll talk to you about resources and provide a conclusion. Thank you.
Thank you, Dwayne. And now to wrap up the webinar, I'm going to share some resources with you. Next slide. So on page 15, you can find the application and award overview information. This will remind you again about things like the ceiling and the floor for the annual awards, the application due date, which is in bold, May 17th, 2023, and the anticipated start date. So you can find all of this information on page 15 of the NOFO. Next slide. And just a reminder again about the Q&A process for programmatic questions that are sent to OPA. If you have programmatic questions, first, please check the NOFO to see if they've been answered there. If they have not been answered in a NOFO, or you're not sure about what the NOFO is saying, then submit your programmatic questions to OPA by email or phone. We will review your question. If your question is one that we have not previously answered, we will draft a response and add that to our published Q&As, as well as contact you to let you know that we've responded. We will be updating our posted Q&As weekly with new answers. And if your question has not been answered by our Q&A, we will reach out to you and let you know what the answer is. But we have a clearance process for providing all answers. So please be patient. It will take at least a week for us to update Q&As and or respond to you if needed. And bear in mind that we will only answer general questions about the NOFO and clarifying the NOFO. We cannot give anyone individual advice or recommendations on a specific project proposal. Next slide. So in the NOFO supplementary materials, there are some resources that will be helpful to you as you work on your application. There are acronyms on page 59. There's a glossary beginning on page 62. There are several pages of relevant resources for applicants beginning on page 67, and we've organized those resources into sections. So there are evaluation resources. There's also a Smarty work plan resource in there as well. And as I mentioned earlier, there's an optional evaluation design template beginning on page 74. This is an optional way template that you can use to organize your evaluation design plan that you submit as part of your project narrative. Not required, is optional. Next slide. We also have our applicant webpage, which is linked on the slide, and Amanda will drop this into the chat as well. On the applicant webpage, you can find a lot of resources about the tier 2 NOFO, as well as about other NOFOs that OPA has currently released, such as the tier 1 NOFO. But I'd like to draw your attention to the fact that on this site, you can find an optional logic model template. If you want to use that, you're more than welcome to do so. You can also find an optional work plan template for your Smarty work plan. Again, it's an optional template. If you want to use them, they are there for you to use, but feel free to use an addition, a different format if you so desire to do that. Next slide. Another resource that you'll find helpful is the Reproductive Health National Training Center, the RHNTC. This is a site that OPA uses to post a variety of our technical assistance materials. And several of the resources that are in the selected resources section of the NOFO are actually posted to the RHNTC, but you can do searches to find adolescent health related resources. You can do searches specifically to find evaluation and improvement resources. So you can find a wide variety of toolkits and briefs and even webinar recordings on the RHNTC. So I encourage you to take a look at those resources as well. Next slide. And OPA is hosting an evaluation webinar, an evaluation technical assistance webinar next Monday afternoon at 4 p.m. It's on summative evaluation, and it will cover various rigorous evaluation techniques and approaches that are used or have historically been used by OPA funded recipients in order to measure the effects of various programs. So Amanda can drop the chat, can drop the link to the registration for this webinar in the chat. And we'll move on to the next slide. So this concludes our webinar, and we will put the registration information in the chat for that upcoming summative evaluation technical assistance webinar, informational webinar. But at this time, I would like to thank you for your attention and for your interest in this funding opportunity. And I will say that we will be taking all the questions that have been submitted into the chat and drafting responses to them. And those responses will be posted within the next few days. And we will also be working on posting just a minute. I'm going to post the webinar chat, the webinar information to the chat. Okay, so the webinar next Monday, information to register is in the chat now. And I was just also saying that we will be compiling answers to the questions that everybody has submitted and posting those to our website in the upcoming days. This webinar's recording will also be posted to the applicant webinar page in the upcoming, in the next week or so. So it will be available to you as a resource if you want to listen to it again. So at this point, I would like to thank everybody for your participation and hope that you have a great rest of the day.